Right now in Glendale, healthcare workers and public safety officials, they are testing out how prepared they really are when it comes to an emergency. Our David Chasanov joins us live from an active drill. This is at the Arrowhead campus of Phoenix Children's Hospital. David, this is essential because you need to know that you're prepared. The wrong time to find out if you're not is during the actual emergency.
Absolutely, Justin. You're right. Good morning. So we're here at Phoenix Children's in Glendale. They're actually just getting started with their drill here this morning. You can kind of see them in the background there. They are experienced professionals practicing out a scenario that we'll explain in just a little bit. But like Justin mentioned, it's important to keep in mind this isn't just healthcare workers here today. We also have first responders as well, and we're lucky to be joined by Glendale Fire Captain John Chester. Thank you for joining us. First off, I wanted to ask you, how important is it to have training sessions like the one happening today?
So in situations like this, in a real life mass casualty incident, what happens is we always resort back to habits that were created in training and drills like this. And the Glendale Fire Department is extremely fortunate to partner with Phoenix Children's Hospital, who has collaborated and coordinated with Glendale PD, Glendale Fire, and our transport partners to create this mass casualty drill to reinforce those habits so that when something like this does happen, we have something to fall back on along with our basic training.
Yeah, very essential to have something like this happen today. How important is it to have that camaraderie between first responders and healthcare workers in situations like this?
So it's huge, right? So on a day-to-day basis, multiple times throughout our city and through our automatic aid system, our firefighters and our cops and our ambulance and ER staff work side by side, whether we're bringing patients into the hospital or we're working with PD on a scene. Working with each other and collaborating is a day-by-day basis.
Well, thank you so much for joining us. We're now going to be joined by Dr. Paul McPhail, who's helping oversee this training session today. Tell me, what's the scenario here?
So basically the scenario is that we're having an exposure event at a local high school, in the Agua Fria High School, that is going to actually bring a number of patients to our system to help stress our system here and kind of push the bounds of what we're able to accomplish in the emergency department and kind of test our limits.
So I understand this drill, or a drill like this, happens basically every year. What is the most important thing that folks can learn today from practicing out a situation like this?
So the most important thing for us really is how to be prepared in a situation. Heaven forbid we actually experience an event like this. We want to know where our lapses are and where our weaknesses are so that should we ever experience this type of an event, we are ready and we have addressed those failings in the advance.
And of course, Doctor, this is not at all impacting other operations around the hospital today, right?
Absolutely not. We are continuing to provide the same excellent and high quality care that we always do. We have a number of actors who are being brought in, simulating patients who are then being seen around the primary care that we're doing in the emergency department today.
Hey, very important to know. Thank you so much for joining us.
Pleasure.
So keep in mind, business as usual here at Phoenix Children's here in Glendale, but we'll send it back to you, Justin.
All right, David, thanks for that.